Good morning, everyone. We are back with another session with BW Legal today on the changing dimensions of right to health amidst the COVID-19 crisis of India. We will be discussing the right to health of Indian citizens under Article 21 of the Indian Constitution, supply chain disruptions caused by the pandemic, suggestive measures for national healthcare policymakers, waiver of intellectual property rights for the manufacturing of COVID vaccines, and many more pressing issues brought by the pandemic. We have with us here today Mr. R. Singh, General Counsel from Norvatis Healthcare, Senior Advocate Sachin Puri from Delhi High Court, Advocate on Record Dhruti Kapadia from Supreme Court of India, Mr. Sudhir Mishra, Managing Partner from Trust Legal, and Mr. Vaibhav Kakkar, Partner from Luthra & Luthra Partners. We'll be starting with our opening question, which would be asked to Mr. Singh. So, Mr. Singh, as we well know, right to health is a part and parcel of right to life and Article 21 of the Indian Constitution. Does our right to health under the Indian Constitution stand compromised in the prevailing situation? What is your comments on that?
Sure, thanks. And this is a great question, but I would say that this can also land us in trouble. You know, the kind of political atmosphere in these days. There is already a huge debate on whether the government has acted in time to address this, huge second wave that has come to India, or whether the health of citizens is compromised in any way. And I would agree that the right to health is definitely part of Article 21 of the Constitution. And I think, I have my esteemed panelists who are practicing lawyers in this, both High Courts and Supreme Court. They can confirm this. But I did hear that, this has been confirmed or reiterated by the Supreme Court itself in several judgments. And so if you ask me whether the health of citizens was compromised, my answer would be yes. But I would also add that it is not necessarily now, because it is well known that India always has had, a very poor health infrastructure. It's for decades now. And there are so many deaths that happen routinely in India, whether it could be because of infant mortalities, or it could be, simple causes of malaria. And these are all, very avoidable deaths. So I would say that, this crisis, this unexpected and unprecedented, second wave has put huge pressure on the already poor, health infrastructure in the country. And, this was something which was always there. In a way, I would say that, we didn't have enough doctors, we didn't have enough nurses, we didn't have hospitals or life-saving drugs. But I think it got accentuated now. And I think, this is bound to happen as such. We were actually ready to take this kind of a crisis, in such a badly prepared manner. And it really affected us. So it did, to answer your question, the health of the citizens did get compromised, more so because of the second wave that we are in now. Yeah, I'll stop here, Anisha.
Mr. Mishra, would you want to give us your comments on that?
It has gone beyond. It has gone beyond all academic discussion now. I think most of the people who are sitting here, whether they are Supreme Court lawyers or Delhi High Court lawyers, we have been for last 45 days have seen something so unprecedented in the courts. There were no Saturdays, there were no Sundays, there were no morning time, evening time. I remember troubling my senior advocate Sacchin Puri at 6 o'clock in the morning. Till 2 o'clock in the night, judges were deliberating what will happen on a Sunday. So right to health as part of the constitutional law, as Article 226, as Article 32, has been reaffirmed every second, every moment, every minute, every hour in India in last 45 days. Now, there is a bigger message here. The bigger message is, which I have been talking of late, that in last 6 months back, if you remember, there was a very big talk about judiciary being dormant. or judiciary, or also being in a position where there were questions how independent we are and how much we are contributing to the development of the democracy. And there were a lot of contempt petitions happening with regard to comedians saying something about our very important court, apex court. And that was the debate you had landed up. Forget the health crisis which the world is witnessing and India is witnessing it full blown. You also realize that judiciary, with all its hands tied, is still managed to get phenomenal support for the common man. And that happened across the country. It's not only Delhi High Court. There were judges in Tamil Nadu, there were judges in Calcutta, Allahabad, Uttarakhand, you see, and orders have been passed on a small thing. I can tell you, when Mr. Puri will speak, I approached him like we were friends, but I was not knowing what motivated him to appear for everybody. No, and I'm telling you, these are the practical questions. Nobody asked me who is going to pay, how much is to be paid, which is the organization. And they actually volunteered and said that, look, we are not going to charge for it. Though, Mr. Puri, let me tell you, one of my clients insists today that you should be paid for it. So this is a very interesting time we are in. We have to see what kind of character we are showing as a society. In our WhatsApp groups where defense colony lawyers associations are together, we see a lawyer struggling to pay his fee in Gangaram or some other hospital. Within hours, all of us deposited money and we were stopped. Other lawyers were Vaibhav stopped that please don't deposit more money. So look, as a society, we have really come up very strong. As a part of the court system, we have come up very strong. So many new jurisprudence will be created out of it. Public health will become entirely new domain. What happened in 1986 after the Bhopal crisis, you will see after this pandemic, there'll be a huge jurisprudence which will decide the future pandemic laws and other stuff.
Absolutely. We totally agree on that. Taking it forward from there, Mr. Sachin Puri, we'd like to ask you the next question. According to you, which is the one aspect that has changed the dimension of right to life as was viewed prior to this pandemic crisis? Could you let us know your comments on that?
See, according to me, the one thing which has really changed everything and which is really something that we need to look at when we talk about changing dimensions is the fact socially responsible behavior of individuals. That is one most important aspect which is going unnoticed and which needs focus from the lawmakers, from the courts, from the citizens. The second wave, whatever you may say, you may give, there was religious processions, there was this, there was lack of infrastructure, there was lack of medicine, all that keep it aside. A third wave will come if you do not have socially responsible behavior patterns set in place. People do not respond how they have to act in public, how they have to be wearing mask, not wearing a mask, where they can do what. So you have to remember, even in UK today, where most of the people have been vaccinated, they are talking of a danger of another wave coming and maybe a likely lockdown today because of this reason, because people again started moving out and everything came back to normal. In India, if you see the pattern between December, especially between December and early March, it was unbelievable. We were having parties, we were going for holidays, we were in malls, we were everywhere. And all the responsible behavior was given up. And let me tell you one thing very important in this is, before I conclude the answer, I want to keep it short, that the educated class is responsible. The youngsters in the age group of 20 to 50 are responsible because the youngsters believed that COVID would not damage them as much as it would damage the elders. So the responsible behavior, mujhe to kuch nahi ho sakta, the responsible behavior was thrown out of the window. The educated and the rich believed the health infrastructure is enough to take care of them. They did not adhere to these patterns. Whereas the fact of the matter is that our rich have suffered, if not more, equally as our poor have. Oxygen availability has hit everybody across the world. Lack of medicine, hoarding has hit everybody. Poor, yes, have been hit more by the hoarding and black marketing than the rich, but everybody has suffered. So I think that is one thing that we need to focus.
Ms. Kapadia, would you like to give us your comments on that?
I would like to put in a couple of things because, see, I'm from Mumbai and my scenario in the city is as much as difficult as it is in Delhi. So it is not Mumbai, Delhi, it is all over India, it's all over the globe. So the problem here is we citizens are not conscious of what we ought to do rightly. If we were conscious enough of what our rights are, how we need to behave socially, and how we need to follow the protocols, the spread would have not been to a greater extent like this. We say, yes, we are sitting here, we are doing a virtual online hearing, then we can go out, we can meet our clients, for example, in the legal field. But when the clients come, we don't tell them, put your mask up properly. We say, it's okay, you can talk, put your mask down, I can hear you better. So this is just a small example where we citizens take it like carefree notion. In the scare of the mind, we sit back and say, look, this government is doing something wrong. We are not getting this from them. We are not getting that from this person. We're not getting facilities. But have we worked in to put the facilities together? We are trying today by creating WhatsApp groups. We are trying today to communicate with people by telling them that, look, a person needs this plasma, this person needs, can we help? But the same thing, if we would have smoothly functioned with our own governments and said, look, we are ready to volunteer together. Let's make you stronger. Instead of me blaming them, then I think things would have been in a better rope. District-wise, ward-wise, citizen-wise, many volunteers, NGOs have also roped in. The problem here is our medical infrastructure, as we say, the health infrastructure, has not been to a greater level of that which could have achieved because the vision somewhere was lost off. What we should do now? We are all confused. So if we had this attitude and strategies and policies rightly made, which keep amending every now and then, every week there are new guidelines, every 2 months something new is coming up from last March 2020. It's not stagnant. It's not all across the country. Different states, different cities, different places, different people are doing different things. We need uniformity because the crisis is all over. Now the question about Article 21 and the medical facilities together, that which you have posed, I would say yes, Article 21 and health is definitely one together. Even human rights together will be one together because we cannot segregate it. Together with the government, with the citizens, we ought to make sure that we protect our own people around us. Which we are saying, no, nothing has happened to my family members. Poor thing, something happened to my friend's guy, we lost him. But did we try to go ahead and help them?
Absolutely.
That is the question.
Absolutely. Mr. Kakkar, would you like to give us your comments on that?
Sure. Thanks, Anisha. First of all, it's a pleasure to be here and good to get connected with all learned panelists here. There are 3-4 disparate points that I want to make, and when I connect all of them, it'll all sort of emerge as one nuanced thread, which is essentially that, it is without a doubt that right to life is a fundamental right under Article 21, and right to health is absolutely so integral and fundamental to the construct of a right to life, that therefore it is necessary that every resource of every state is deployed for that purpose. Ultimately, we all understand in constitutional law, your fundamental rights are enforceable against the state. When Sudhir is talking about the way legal profession has stepped up, I can't agree with more with him on that subject. But why have individuals and professionals been required to step up? Is because I will put it out bluntly there that the states have failed in the responsibility to ensure the fundamental right to life and right to health being provided for. And this is across the board. I'm not taking a political position here. I mean central governments, I mean the state governments, all of them put together. The other stark and very brutal reality is, Anisha, that if you were to actually look at what India has been like, and as Mr. Puri also put it, that India has suffered from very poor health infrastructure over the last few decades. It's not something new. And poor people have died because they've not got access to health infrastructure, and that's been happening forever. The unfortunate and the most embarrassing truth is the reason why you and I are all talking about it together is for the first time in the history of free India, that the privileged and the haves and those who have, believed that, for the lack of a better word, because of access to money and jugaad, they will be able to ensure that they and their loved ones get access to health infrastructure, are suddenly finding that they're in the same place as the poor man on the street. And this is why we are now actually talking about these issues.
Very well said.
And therefore, I think the reality is that we in our country only realize the value of life when it hits us or people around us. And unfortunately, the second wave in this country has been far more vicious and virulent than anything else seen anywhere in the world and what we saw last time. Absolutely. This is why we are feeling the sting of it. My only hope is that state, judiciary, each one of them need to pull their socks up and, work in a cohesive manner. And I think we will talk about, issues of our vaccination program, policies around it, issues around, what we are doing to further bolster the health infrastructure. Do we really need the realities with the population size that we have? If we are only expecting private sector to really step up when things go wrong, then there's something seriously wrong with how the states are planning their entire health infrastructure development. The reality is any one of us on the panel group, despite all the taxes that we contribute, the reality is that if any of our loved ones were to fall sick, none of us would even dare think of sending them to a public hospital. And that's a fact. So public health infrastructure needs a substantial overhaul. It is almost akin to, your defense infrastructure. Unfortunately, it's never got the kind of attention that it deserved. I have personally filed a public interest litigation in the Supreme Court. We are fighting this whole issue about that when the government in its wisdom could come up with notifications when Rafale jets were being imported in this country for exemption from IGST. Why are we having to litigate with in the court against the state that just like how you have exempted customs duty in import of oxygen concentrators, that we are not getting an exemption for import for IGST levy when you're importing oxygen concentrators? Delhi High Court has yesterday ruled that such state action is unconstitutional who are import for personal use. And even then, the conditions that have been imposed for import, it just almost gives the impression out there that there are a bunch of different agencies and departments that are trying to do their level best. Nobody can question them for ill intent. But it's just that there is nobody at the top which is sort of tying it all in together. Why, at the point in time when we are almost like a war-like situation, I'm not aware of a single incident where import duty was applied on arms and ammunitions. And therefore, no discussions on distortion of cascading duty structure because there are domestic manufacturers. Why such a discussion now? We have to give this almost importance like a national emergency. And I think that's where I'll conclude my remark, and over to you for, your other questions and inputs from other learned panelists here.
Absolutely. That was a very insightful, informative response from you, Mr. Kakkar. Our next question would be to Mr. Singh. And as we were just speaking about medical resources and the public healthcare infrastructure in India, so our question to you would be that do you think that all communities of India coming from both such marginalized and privileged societies are receiving equitable access to medical treatment at the moment? And what is your comments on that?
Sure. I think Vaibhav has put it very clearly and very, I would say, unequivocally that, we are actually looking at these issues because it has hit us, especially the middle class. In fact, I would say even the media has picked it up because, now it is really affecting many of us. But if you look at the infrastructure per se, India is a world leader in the manufacture of vaccines. In fact, we say that, 60% of all the vaccines are manufactured in India. But currently we are facing a serious shortage of COVID vaccines. And maybe, I can talk a little bit about my own experience. Unlike other panelists here, I'm an in-house counsel. I have worked for, some pharma multinationals in the past. And, the way we look at it is that India has a very good manufacturing base. It's a good manufacturer, good place to do your R&D, and it's a good place to actually develop your product or any drug. But India is not seen as a good market, for many of the multinationals, because you again have these policies of price ceiling, the kind of controls that you have by various authorities. So many pharma companies actually shy away from launching their innovative products in India. And I think we should try to understand this reluctance, okay, of some companies which do not really want to come to India, which basically means that many of us are being denied of some of those very innovative, products and very innovative drugs, which could actually, help us in overcoming some of those deadly diseases. If I, come to the current crisis now, what we can do really to improve the healthcare services. I was surprised to see the recent court judgment, especially the Supreme Court judgment, which says that, we don't have a national policy on admission to the hospitals. Each state, each health authority has a different protocol, a different, standards for admitting the patients, into a different tier of hospital. For example, there are some places where it is mandatory to get a COVID positive test for, before you can get admission. And many people have realized that it takes a long time to actually get this test result. And sometimes, you may even get a, negative report, though you may be actually suffering from severe COVID symptoms. Okay, because, sometimes even RT-PCR does not really pick up, especially the new strain that we are seeing. I also got to know that, there are very silly and arbitrary reasons why some people have been denied admission in hospitals. It seems in Ahmedabad, they did not allow patients unless they come in a government ambulance which has this 108 printed on that. And it was necessary for the Gujarat High Court to interfere and, overcome that kind of a challenge. And, I have seen in front of my own eyes in Telangana, Hyderabad, where I am, there were so many ambulances which were stopped on the borders of Telangana because, they cannot come to Telangana because they belong to a different state. A lot of patients have been denied admission because they are from different cities. These are the kind of, policies and standards, even for simple admission to a hospital. There's so much of demand for hospitals, for the beds, for ICUs, for the, essential medicines. But if we have these kind of policies, we are actually shooting in our own legs. So I think, we need to look at these, issues as well. Improving the health infrastructure is one thing, but, these are some things which are placing hurdles, in allowing some, access to some of these hospitals, some of the medicines. So I think we should look at these as well, Anisha. I'll conclude here. Yeah.
Thank you so much. Our next question would be to Mr. Mishra. So as we know, of course, there is a huge disruption in the supply chain in the country for the supply of vaccines in India right now. And even though, of course, there are policies in place for the delivery of vaccine to different age groups, but there is a massive shortage in how the patients are receiving those vaccines. So would you like to give us your comments on that?
Thank you, Anisha. Good afternoon, Dr. Batra. Nice to see you here. See the vaccine.
Sorry, I had to look after my mom. Her sugar was extremely low, so she's just recovered from COVID. So I did inform Anisha and Sudhir that now that her sugar is about 96, was 65 in the morning at about 9 a.m. So that's the only reason but I've been listening for the last 15 minutes. So, I am up to date. So my apologies for joining late. But...
So thank you, sir. The vaccine thing has been, we need to understand it a little bit in the perspective. So in January, our Prime Minister goes to Davos, and not only that, he declares India almost that we have conquered COVID. He also promised many things on the vaccine matter across the world. India also signed an alliance where India was committed to give billions of doses across the world, and that alliance was signed by very few countries, and we did that. Third, what we did is, in our vaccine matter, whosoever brainchild that was, that only you take care of your neighbors, you will take care of neighboring countries. But here we took care of the responsibility of most of the countries which had no geographical boundary attached with us. They were far, but we did go and give vaccines to them. Now we give so much of vaccine, because we already concluded that we have no battles to fight. What Vaibhav talked so nicely, that the kind of when the elephant came in the room, then we actually decided to wake up. So the vaccine we're missing, because we're distributing vaccines to the world, and the vaccine strategy, which again Suraj so nicely said, that you have every day a new policy. Even a child can tell you that what is our vaccine policy. 2 weeks gap, 6 weeks gap, never to be taken again. Give me your vaccine back, whatever you have injected. We have just been left with that option now. Okay. So you have such a huge country. You need to have your plans. You will, whatever data is now being given, your foreign minister is going to America because he has to now convince that US, which has really decided to give 60 million doses of their AstraZeneca vaccine to the world, India wants to get major of it. So पहले हमने पूरे दुनिया को दिया, अब हम वापस लेंगे उनसे. So that is point number one. That's our crisis number one. The crisis number two is, which again Suraj said very nicely, that when you want to bring good vaccines to India, apart from the existing vaccines, which are really doing very well for whatever sample size we have, but they are doing well, we are given to understand. If you have a Pfizer kind of debate, and now it's almost clear that the government and Pfizer have not agreed upon the entry of Pfizer in very recent time. So what are you talking about? You have so much of bureaucracy, so much of babu, that you are not able to decide anything. You are talking about health infrastructure. And let me tell you, I think it was very nicely said by our Bombay lawyer friend. She said it very correctly. What you want, you'll be given. Because if you don't demand that kind of health infrastructure, you never demand. You demand certain other things, that is being given to you. You demand a temple, it is being given to you. You start demanding hospitals, it will be given to you. You demand infrastructure, it will be given to you. Yes, it is right. When it came hitting the middle class and the high classes, which Vaibhav said very aptly, that most of the cities, they realize that they don't have, if judges, lawyers, doctors, they start calling you for beds because you are representing few hospitals, you can imagine the crisis you are witnessing.
You know, I've been listening, Mr. Mishra, I've been listening to the conversation, and I did listen to Mr. Kakkar's remarks that this time it's hit, you know, affluent people, and, you know, the upper middle class. And that's why it is being raised by media, because for many, many years, the not so affluent sections of the society have not been receiving healthcare, and the magnitude of the issue. See, our topic is changing dimensions of right to health and amidst the COVID crisis, and how will it change the course of the right to health? What is the litigation we expect? What is the change in mindset of each of the professionals on this? So I want to start by asking Ms. Dhruti Kapadia, and then I'll go down to Mr. Puri, Mr. Kakkar, and Mr. Singh, and then Mr. Mishra. When it comes to your own consciousness, when it comes to your own sphere of work, your sphere of influence, what are you doing to be able to make sure that we are able to move forward where the right to health is implemented in the spirit that is enshrined in the Constitution, intertwined with the right to life? So I want to understand, what are you doing as individuals to be able to make sure you contribute to this?
It's a very nice question, and I was eager to answer this because I've been working from March 20 on this entire topic of what I can do to make sure that I can participate to help the people around and my own families. So what happened was, Mr. Batra, I will tell you, I've been a litigating lawyer, I've been going to the courts. I'm like, do we need the judicial people to intervene and make sure that we get what we want from right to health? The people are sick, there are no beds. So I made my visits to a couple of places in Mumbai, to slums, to different places, etc. I personally went there because I have my own NGO also. I saw that people are not aware. So there is no awareness program. So social media is not for every citizen. It is for classes of citizens. There are people who don't know what's happening around. For example, hospital bed availabilities, if they want to know, there's a dashboard. BMC is working in Mumbai for it. So this awareness comes on Twitter. We get everything on tweets. etc. and all. But in my professional capacity, I go there and I make sure with my MLAs and constituents, cooperators there, let's go house to house or locality wise mouth publicity on what is happening around and what is pandemic. So this was one thing. About litigation I did was about door-to-door vaccination, which is today pending in the Bombay High Court, and we are really pushing for the policy that every citizen should get vaccine. Those who are specially able, those who are bedridden, they cannot go to the centers to get vaccines. So how do we give them the vaccines? This is something we need to have a framework of policy. So we are hoping that maybe we'll get a policy. The matter is subjudice, so I will not speak more about it. But at least in my own attempt, I became a petitioner in PIL, and I said, I want to take this issue. I want helplines to be introduced. Why should COVID app be the only app where people will get the technology-based citizens would get their vaccines? Why not those who don't have technology? How do you give them on-spot registrations? How do you stop the crowding? How do you make sure that people who are the frontline workers are also safe? Because their safety is also very, very important. Those who are serving us, risking their life, should also be protected. So many times, many doctors say we are not treated well, we are overworked, but we are doing so much, etc. They have seen so many deaths around. So what is the psychological impact? So we need to make sure that as professional lawyers, we be nice, calm, cool, and compassionate towards our own people. Lawyers say if they don't have work, there is crisis of financial things, is not only lawyers, it's everybody around. So how do you help them? So what I did in my personal experience, as Sir was asking, I tried to donate mobile phones to people in the slums, limited versions which has online possibilities to study online. So this is something we could do in a compassionate way. We don't have to believe that only law will be the only thing that will help them. Any small deed that you can go around and help people would change their lifestyle, would help their family, because people are not going to schools to study. Health is affected mentally. We are only talking about physical health. No, we have to think about mental health also. How are people happy in their house? Husband and wives are fighting. Divorce cases are increasing. I'm getting n number of calls of domestic violence. There are good positive things also where people are settling the disputes. So all these things professionally I'm facing, seeing, I'm happy about it, I'm sad about it. As the coin has two sides of it, we are only more focusing and criticizing things. We are not trying to weigh it and make our own mental health happier, that yes, there are positive things happening. People are recovering and coming back. They're having new meaning to life. So this is something professionally we must push our own self, stand up for whatever is right for humanity. Health is always the first priority. Money will come, but health gone will never come.
Absolutely. And Ms. Kapadia, Adam Grant wrote a piece 3 weeks back in the New York Times, which he called the feeling that all of us are in some way experiencing, called languishing, where there is no enthusiasm for what you do. Sometimes there is lack of enthusiasm and there is lack of energy while you're doing it. There is something that kind of makes it incomplete because there is so much of anxiety and grief. Also, Mr. Puri, I'm aware that you did go to the High Court and what is now known as the oxygen bench, and you did argue your case for making sure that oxygen is supplied immediately to hospitals. But beyond that, what do you see the changes in terms of in public health litigation going forward? Do you see the number of cases rising? And as I asked Ms. Kapadia, I know about this because we wrote about it and we did interact on it. But tell us, what else are you doing to make sure in the future, if at all there is a need for infrastructure, we never face this situation? So how do we make sure that the pressure that we put on the system, a positive pressure, how do we make sure that we keep it sustained and we make sure that we build our muscle while there is no crisis?
Thank you, Dr. Batra. Dr. Batra, in fact, other than the case that you're talking about, I was almost every day, and rather the term used almost would be incorrect. I spent hours and hours before the oxygen bench and other benches in various litigations, whether it be, as Suraj was mentioning, the requirement of a positive report. In fact, that was one of the first orders I had obtained, that a positive report is not required for admission, hospital admissions, whether it be oxygen supply issues, whether it be release of oxygen concentrators to the public, starting with 170 concentrators. That also order I had obtained early morning at 10:30, when I heard the oxygen cylinders were seized and lying in a police station, cutting across all the CRPC rules. We were able to do that. whether it be the import policy, whether it be exemptions, those exemptions which has been granted to the individuals by the bench, the other exemptions were persuaded to the central government that to grant those exemptions, whether the setup of the portals. It has been just the insurance time taken in the hospitals. It was endless. 2 lakh cash limit. I can go on. I don't even remember the number of orders that I have been able to take from the courts, persuade the courts for them, and the central government or the state government for that. So those 2-3 weeks were really, really hectic, and there's endless work. And now that I step back and I can see that what, as you put it, what is that going forward we need to do. Just adding to that on the personal level, before I answer this part, before coming to that, personal level, yes, contributions to the RWA to set up their facilities. The individuals, as Sudhir mentioned, we were both in the same group when that particular incident of Gangaram came up. And whether it is providing medicines to all the known, unknown, oxygen cans, admissions to the hospitals, whoever you could help, and anybody in those days could just simply call up or approach. And I was not in a position to say no, knowing that I know him or I don't know him. It was whatever one can do was doing. Yes, it would leave you emotionally shaken at times, but that's the way it was. But also a lot was brought in from abroad. After forcing the Delhi government to open its portal to bring imports from abroad and get the contributions from abroad, I am told, in fact, one of my cousins, Sona Khosla from Canada, started this group which has been able to generate support of about $12 million in last 1 month. So there is lots that has happened at the personal level. Going forward, already the oxygen bench has commented a couple of times, and they are looking into the black fungus issue, as I was pointing out. The medicine shortage for black fungus is being looked into, that how and in what manner that is to be addressed. The issue of whether the hospitals should and ought to at all times, hospitals of a certain level, let us say 100-bed plus hospitals and nursing homes, which are there, or 200-bed ones, where we have suffered a lot due to the breakage of the oxygen supply chain. Whether they should all mandatorily have oxygen plants within the complex itself, sacrificing a portion of maybe a parking area or the basement area or some other area, we're making it mandatory so that we do not suffer a similar fate. And also, I think that courts are also looking into the issues which are of how to streamline, whether it's the vaccination drive, whether it is the essential life-saving drugs. And in fact, now the issue is also coming up, for which I've been recently informed. In fact, yesterday I was informed that the CDC policies and the policies of what is the guidelines for treatment, which are being followed in India. There are suggestions which are coming from doctors from the US, Indian doctors, mind you, and the UK, and as many as health professionals across the country, ranging to 25,000. Who have opined that there are certain other measures which need to be added, which is also now likely to come up on Monday or Tuesday. So yes, there are various things which are coming up, and all suggestions from the panelists, from individuals, from you especially, are welcome wherever you think there is something that can be done, at whatever level it can be done. One must try and do it.
Thank you so much. Mr. Kakkar, I would like your commentary, and then I can bring in Mr. Suraj Singh.
Sure. Thank you. Thank you so much, Dr. Batra. First of all, it's a great question, and I hope your mother feels better. Just to sort of, further take it from where Mr. Puri left, I think there are two parts to this. One is, what did we do personally by virtue of being a lawyer, by virtue of being a citizen in the society? There are 2-3 points that I want to share with you.
And I'm aware that you did lose a colleague of yours, a partner of a very young partner.
That's correct, Dr. Batra. Almost somebody who that's right, Dr. Batra. Almost somebody who I worked under as an intern, and today I led a team of 20 lawyers along with him, and he died all of 46, leaving a 2-year-old daughter behind. So it's been absolutely devastating at a personal level. I'd like to actually share 2 or 3 parts to this. One is that I, along with a very dear friend of mine, Karan Chandok, decided to sort of set up a social media campaign. We were able to raise about $250,000. Then we decided to import oxygen concentrators from different parts of the world. And that's where we realized there was a bit of a lacuna. The challenge was, Dr. Batra, that China actually shuts down 2 or 3 times a year. And one part of the year, which is absolutely sacrosanct for them, is the Labor Week holidays, which was from May 1st to May 7th. And so China was shutting down, and China is the manufacturer of 90% of oxygen concentrators in the world. Like most other products where they are continuously the market leaders. So what an irony in the backdrop of all the India-China conflict that we were really looking to China to help us out to get our breath of air. And what we realized was that because that was a Labor Week holiday, China, it was very difficult to import concentrators from there. And all your supplies only started coming in much later. And there was also the issues of getting the right product and the right quality. Also, a lot of spurious products made their way into this country. So what we actually did was, I'm part of the CII National Committee on E-commerce. I'm also part of the FICCI Committee, National Committee on E-commerce. What we were able to do was we were able to, through industry bodies, identify other jurisdictions in other countries and use their industry channel and the trade body channels to be able to identify credible suppliers for oxygen concentrators, oximeters in other jurisdictions. I think, and as I'm sure all of you are aware, and Dr. Batra, that suddenly we had this whole issue that some of the main state carriers from China and their crew became uncomfortable to travel to the country. And there was this whole problem that for 2 days, nothing moved from China. And I think that's one lesson, Dr. Batra, that until India becomes a large manufacturer of medical supplies and medical devices, we will be relying hugely on imports. And that old adage that, never put all your eggs in one basket. You need to diversify. You need to have credible suppliers in different jurisdictions such that you're not at somebody's whims and fancies and somebody's, mercy. I think that was one important lesson. So we were able to, through FICCI and CII, and God bless them, were able to immediately contact industry bodies in Taiwan, for instance, in Turkey. And we were able to get concentrators from there as well, which I'm happy to share with you that 200 concentrators have already come in, which have now been supplied to various charitable organizations, including St. Stephen's Hospital, the Khalsa Group, Hemkund Foundation. So we've been able to actually achieve that. Number two, over and above that, what we were able to do, Dr. Batra, is that we were able to connect with this group called Aster Group. They're a very large healthcare giant in southern India. Correct. But they have no presence in northern India. So they had tied up with, they've been doing a lot of CSR work with a particular hospital in Okla called Al Shifa. It's a charitable hospital. And so we worked with them. We were able to liaise with Delhi government, get them urgent permission, and get them setting up a 50-bed field hospital in a primary school that the trust itself owns. And I'm happy to say that the hospital is functional, and we have funded them for almost $100,000 for that purpose. And this is all money raised through public. A lot of lawyers have stepped up, a lot of senior advocates. And this just goes to show the camaraderie that everybody has shown. And we've had more than 1,500 donors. So this is the personal experience as a non-lawyer. Over and above that, Dr. Batra, I have personally filed a public interest litigation, as I'm sure all of you are aware, that customs duty, basic customs duty was exempted, but IGST continued to be levied. The finance minister's argument was that it will have an impact on the cascading reverse structure.
Yeah, but I heard you in the opening remarks, you said in times of war and in times of, we didn't care about it. So why, if this is not war,
then what?
It's not about saving lives, then what is it about?
Absolutely.
So, thank you for doing that. Mr. Suraj Singh, the role of pharma companies is really crucial, whether it comes to vaccines, whether it comes to making sure that the medicines that are needed both in this epidemic and, to treat other issues that have come up because of it, the epidemic, are affordable, are easily available. And there has been shortage of some of these. And so give us a sense of what have been your thinking on it and what's been your action on this.
All right, I may not be able to talk on behalf of my company, Dr. Batra, but yes, I think, pharma companies have a big role to play. Having said that, there are times where, we don't really understand the technical aspects of, manufacture of vaccines. I just want to bring up, maybe a balanced perspective to this whole thing. It is sometimes said, in many forums that, why can't all the pharma companies take up the manufacture? But, I heard an interview of Kiran Mazumdar, of head of Biocon. She basically, when this question was asked, she said that, it is not really possible for every pharma company to start manufacturing. You need to have certain unique clean room technologies. There are some, infrastructural requirements before any pharma company in India, for example, to be able to start manufacturing. Sometimes we very easily say that, why can't everybody pick up this manufacture? But, we need to also understand the ground realities, because, when Russia was offering Sputnik 5, there were not many takers in India, except Dr. Reddy's, which, had that particular infrastructure to be able to, manufacture and supply. So, we also need to understand the other side of the coin. But pharma is actually doing quite a bit. And maybe, sometimes it may be necessary for you practicing lawyers as well to get this compulsory licensing. Okay, to be, because, I think Indian Patents Act does permit, has certain specific provisions, to get this compulsory licensing activated. It is possible for some other, Indian pharma companies to start doing that. Somehow I don't hear much on this front. I kind of have seen the Supreme Court judgments, and I have also seen the Supreme Court directing the government to, invoke compulsory licensing, but it left it at that stage. It basically left the government to also negotiate with the, pharma companies and, bring up this vaccine production in India. But yes, I think there is a huge role to play, because now we still have only 2 Indian companies manufacturing, and we just have this third company. Let me also add one more component, Dr. Batra. You spoke about what we guys are doing in personal capacity, and I have heard these great stories from this esteemed panel. From the professional capacity, I also want to bring it up, is that we have pharma employees working throughout the year, even during the lockdown, because this was an essential service and we had to continue manufacture, and which basically means that the workers had to work from the facility. Unlike many of us who are working from home, they had to actually travel even during the lockdown time. Some very unique questions that were posed to me as a legal counsel of these pharma companies. Can we get a mandatory testing of the workers done? Can we compel the employees undergo the testing mandatorily? In fact, even before that, can we even have that kind of an infrastructure in place in our companies? The second big question that came was, can we have the vaccination done for the employees who are working from the facility? Because they are traveling every day to this facility. And I have faced a lot of hurdles on both these fronts. For example, if I want to arrange a vaccination for my, company workers, some governments are not allowing that. For example, some companies which have a presence in many states, they are able to get vaccines in other states. But in Telangana, we still cannot, get the vaccines for our employees. There are some companies which have the money to even import vaccines from outside. But still, we are still not able to do that. The policies does not permit me to import Pfizer's vaccines or, Moderna. There are still these kind of, policy decisions that needs to be taken. But yes, these are great questions, but I think we still need to grapple with the situation here.
Thank you so much, Mr. Mishra. In terms of, I am aware, and the panel is aware of the work you've done, and you collaborated with Mr. Sacchin Puri, and you constantly been at it both in a personal and a professional capacity. What do you think needs to change in public health litigation? One of the aspects that we didn't touch on, and maybe next Saturday we will, is this issue of health insurance. Health insurance plus COVID insurance, and how it is impacting everyone. And again, of course, going forward, the insurance companies and insurers have ensured stricter scrutiny for enrolling insurance claims and so on and so forth. So there will be some litigation on that count. But what do you see will change in terms of public health litigation? Will it become more proactive? Because we tend to get active when there is a crisis, when there is, the air is not good. We know every year that we face an issue in certain months, but only around that time. Why are we not able to keep that sustained and create change in the policy and implement what needs to be implemented? Do you think for the first time we'll see that people like you, people like Mr. Puri, will be able to take these things to their logical conclusion and ensure that we don't need to do this activism or litigation next year? You'll have to unmute yourself, Mishra.
You are right, Dr. Batra. Now it looks like more like, I would say, a very hurricane response from legal fraternity and judiciary put together. But if you see the history of our country, all the major environment and public health issues were taken up by courts in a phase. There was a phase. So 1980s was a phase when a lot of work happened on Menka Gandhi versus Union of India, and MC Mehta was filing a lot of issues with regard to environment. And we had a compulsory forest bench for since I started coming to court from 1999 to 2009. Hari Salve used to be on every Friday before the green bench. So we had a consistent public interest lawyering happening for phases in this country. If you remember 2015, I actually coined the word public health emergency, and Vaibhav, I filed a petition, Sudhir Mishra versus Union of India, which is the Delhi air petition, which is going on for 7 years with the court on its own motion. At that time, the climate was still there for some kind of public interest litigation. Dr. Batra, this is a very momentous, I have been telling this, that what is very momentous about last 45 days, that after years of interval, after years of inertia, finally judiciary is also coming up in a kind of a momentum. And I am not somebody who wants it to take over the place of executive, but the kind of crisis this country is and the kind of pattern we have shown since we became a democratic country and we had a constitution, that judiciary always played a very important role, whether it's a period of emergency, whether it's a period of greening of this country, whether to save the 16% of forest cover, save the tigers. So I think public health lawyering will gain momentum unless we have those extraordinary factors which come in picture and those cases are scuttled in some manner or another. That's one part. The second part is insurance you spoke about, and that is a growing concern now. And Dr. Sacchin Puri, Sacchin Puri will have to come back to you for this. I have at least 7 or 8 cases now from the patients, and invariably the hospitals only refer this to us, that insurance companies are not covering the entire cost. That is one. And the second part would be when the black fungus, which is now declared as an epidemic in most of the states, and it will become a national phenomena, and the kind of fight you are going to do, there will be a need, Dr. Batra, for us to move to court as early as Monday, which we are looking at, to think of capping a price for black fungus treatment, because you are talking about a treatment cost of around 8 lakhs to 35 lakhs rupees. So we need some kind of momentum there also. So these are the challenges I'm looking at, Dr. Batra.
Thank you so much, Mr. Mishra. I'd like to get into closing comments because 1 o'clock, every Saturday, 12 to 1 and 1 to 2, we focus on legal issues. From 1 to 2, we are focusing on the Tarun Tejpal trial, and we will be BW Legal World and experts from Trust Legal, experts from our team will be talking to Mr. Pramod Dume, who is a criminal lawyer and who was involved in the litigation amongst another battery of lawyers, and we will talk about how the litigation happened. We'll talk about technical points. At this point, I'd like to close it by asking very short comments, 30, 60-second comments. Let me start with Mr. Vaibhav Kakkar, then Mr. Suraj Singh, Mr. Puri, Ms. Kapadia, and finally Mr. Mishra. Mr. Kakkar, your final comments.
Thank you, Dr. Batra. 3 very quick points. I think what Mr. Suraj Singh said. One, while there is definitely an issue of capacity, and just given the size of our population, there will be a genuine problem of delivery. That we also saw that in the United States, which has got the best health infrastructure in the world. What, however, is absolutely paramount is needless deaths because of policy paralysis. That can be avoided. Two very quick legal reforms as a corporate commercial lawyer, what I'm dealing with. One, I think under the CSR rules, as most of you would be aware, it is illegal or it is not permissible to utilize CSR for the purposes of benefit of your employees or your organization. I think I have made representation on behalf of a number of companies that please make an amendment, allow companies to utilize CSR funds for the purpose of vaccination of your own employees and your vendors and your suppliers. So I think that's absolutely necessary. It'll be surprising and shocking.
Fantastic.
The second point very quickly is under the FCRA. Right now, any foreign multinational company, I'm flooded with queries by global MNCs that actually want to send money, COVID allowances to their own employees in the country. But unfortunately, the law on FCRA is so vague that there are some challenges. Banks are not processing inward remittance to the bank account of employees for COVID allowances from overseas. And through the Indian subsidiary, there are other challenges. So I think there needs to be, while we understand that the government wants to strongly regulate through the FCRA, the NGO and the civil society, but for the purposes of tackling the current crisis, the pandemic, for health infrastructure, there needs to be an automatic exemption. It can be time bound while the crisis gets over. The third point very quickly is that the health infrastructure, everybody can ask the questions, where are all those ventilators that were manufactured at, huge pace last year? The reality is a lot of that got sold, a lot of that underutilized got obsolete. What needs to happen is we have suddenly woken up to this crisis. Everything is happening on a war footing, but we shouldn't forget that just now when the infection rate goes down, that this capacity will be underutilized and we then render this obsolete. We need to be prepared for the third and the fourth wave, and for that, we will have to be okay with the idea that there will be health infrastructure which is underutilized for some time, and so be it. And that's the cost that we need to deal with. And last point, I think overall, if you were to ask folks in the finance ministry in closed room, and you were to ask them, what is the reason you're hesitant to impose a national lockdown? It's coming from 90% of GDP being under debt, if you were to combine in state and center budgets. And I think the fear is that if there were other national lockdowns, there will be a requirement to give similar monetary and fiscal incentives like last year. And suddenly the sovereign rating will go down, and that will create a huge spiraling effect. But I think the reality is the world is giving signals that in times of crisis like these, jaan hai to jahan hai, print currency, let the fiscal deficit go up if required, but you got to save lives right now. And if that means national lockdown, if that means economy being saved through fiscal and monetary incentives, I think the global credit rating agencies will show mercy. They will not downgrade the currency so quickly.
And there is a larger debate. I run a business and economy product, and been an entrepreneur for 20 years. Went to a business school. I'm not sure that's relevant, but the fact is, there's a larger debate. Should GDP be the real indicator of the progress of a country? If you can have 6%, 7%, 8% GDP, but such large number of people die every day, what is the point in having that GDP? I mean, we had this debate about happiness, looking at Bhutan, is happiness the way to look at the development of a country, the development of a nation? So clearly these are very important issues Vaibhav, you brought in. Mr. Puri, your closing comments?
Being very short on that, only thing that I want to add in this entire discussion is that right to health necessarily, should each of us realize, includes our individual responsibilities and pushing a higher GDP towards health infrastructure. Today, it's only what the country is utilizing is 1.5 to 1.8 or maybe 2%. We really need to do that. The hospitals need to improve, and citizens' behavior pattern needs to undergo a change if we are going to meet such situations.
Thank you so much. Ms. Kapadia, your final comments?
I would just like to put forward 4 things, actually, not 3, because something that we all have forgotten to speak about, but in the back of our minds, we definitely know. We need more resources. To start with, doctors should increase more in numbers. Medical professionals should be more involved. So therefore, we need more medical colleges. Instead of
we need more nursing colleges.
Nursing college.
You know, it is more difficult to get a license for a nursing college. I mean, for hospitals, Dr. Devi Shetty applied for he has a hospital, he has a listed entity, he's a very credible voice in healthcare. And he applied for a nursing college license for 4 years. He haven't gone so that he could train more people. And you're so right, Ms. Kapadia, that the answer, we keep saying more investments in healthcare. That's part of the answer, is that more trained, skilled professionals to be then exploiting that healthcare investment. So that's needed. You hit the nail where it needs to be hit. Yes, go on.
Students go to Russia, to Germany, etc., USA to study and practice doctorate there. Why not in India? Why not we develop this infrastructure?
Yeah, and I want to make this point. I went to an engineering school, then went to a business school. My passion of being in media and my destiny brought me here. But the fact is, in the engineering school, the reason we've been able to build Infosys and TCS is because of the number of engineering colleges. It's a supply-demand issue. If the number of seats in engineering are so much, then there is no issue. We've created manpower. Similarly, in the healthcare domain, in medical colleges, we have created an artificial choking, for the reasons that you all are aware of. We need to take that choke away. We need to create more supply. The day we create more supply, we will solve this healthcare issue to a big extent.
Moreover, even in the rural areas of India, we have been covering that part of it. We've not been seeing the numbers of cases there. Why? Because we are not covering it. Media only focuses on the heavy lot of city, where there is commercial loss, where there is financial drop down, where there are people dying who are like in a different levels of zones. So India is diversified. It has different groups of people. We need to focus on every citizen. Every life is important. We should have policies which will clear the fear of the people in their mind, that we can get our medical facilities as and when we want with rightful manner. It should not be that I need to pay more, I'll get the bed. If I don't have the money, I'll die in my house. That should not be the attitude. People should
absolutely. Every life matters. Every life matters.
Every life matters. And thirdly, we should have policies where vaccination should be done door to door for people who cannot go out, for which I'll be fighting my PIL for done and good support from the courts also. The reason being, if we do not take precaution is better than cure. If we do not take vaccines, we're going to ignore those sort of people and just going to be like, okay, let the few get first, then let the others get later. With the phase-wise thing, we are spreading out more of the diseases around. We can't balance it. So there has to be a balanced check.
Thank you so much. Mr. Suraj Singh, your final comment, and finally, Mr. Mishra. And Anisha, I'd like you to make a comment, too. Yes, Mr. Singh.
Sure. Thank you, Mr. Batra. I'll be very short. I actually would love that, the litigations filed by Vaibhav succeed, especially on that CSR and FCRA front. Because, it would be great if I can actually spend that money on, getting the vaccinations for the employees and also on the FCRA. My last comment would be that, somehow this coronavirus seems to be one step ahead of us, all the time. And I think we should not lower the guard this time, just the way we did in the first wave. And I hope that, we are much more successful and this too shall pass.
Thank you so much. Mr. Mishra, finally your comment.
The show must go on. That's all.
Thank you so much. We thank all our panelists, Mr. Sacchin, Puri. And Anisha, your comment before we close. Sorry.
Yes, firstly, thank you so much to all the speakers for giving us your time today. I mean, all of the information was so extremely insightful, especially considering that we are going through one of the most critical times that the country has seen, that the independent India has seen so far. So thank you so much for giving us your insightful information. I'm sure our viewers would be extremely engaged by today's conversation. So that is what I wanted to ask. And we look forward to having you again with VW Legal.
Thank you. And kudos to you, what you've done in both your personal and professional capacity. I think we got a very passionate, very, very concerned, very active set of panelists today who not only are professionally accomplished, but as human beings are making a huge impact in whatever way they can. So thank you so much for doing what you do. Our gratitude. God bless you. And may your efforts bear all the right fruits for everyone's benefit. Thank you so much. As I said, in the next 10 minutes, we'll switch on to the trial of Tarun Tejpal, and Mr. Pramod Dubey will be discussing this with Ms. Ritvika Nanda from Trust Legal to be able to dissect that. And my senior editorial colleague, Mr. Rohel Amin, and Mr. Krishnendra Joshi will join in that discussion. Thank you so much. We'll see you next Saturday. Thank you.